A warning in Quebec after an unexplained case of measles.
We think that it's a beginning of a transmission inside the community.
Laval health officials say an unvaccinated individual somehow caught the virus even though they hadn't traveled. They went on to visit a school, store, a clinic, and a hospital, all while highly contagious.
We are kind of worried about the evolution of measles inside our community.
Those fears follow reports of a man in his 30s living north of Toronto who also caught the virus but doesn't know how.
The unique thing about this case, and rather unfortunate thing, is that this case does not have any travel history or any history of exposure.
He had 2 doses of the measles vaccine and only mild illness.
We do know that people who are vaccinated can get a mild form of measles, and we think that they're much less likely to transmit it onwards. So that's certainly good news here.
There are only a handful of measles cases in Canada right now, but healthcare teams are bracing for more infections as global travel heats up.
South of the border, 41 cases in total have been identified across more than a dozen states, including an outbreak in Florida, a hotspot for March break vacations. This Montreal pediatric infectious disease specialist says high vaccination rates in Canada should keep the disease at bay, but
there can be certain communities or pockets of areas where the coverage rates are not high enough to stop secondary transmission.
Canada's top doctor told us Canadians should make sure their measles vaccinations are up to date.
If in doubt, I think one dose, getting a dose of vaccine prior to travel would be an important consideration.
And multiple experts agreed curbing the spread of measles is crucial given the risks. It can lead to serious complications including blindness, brain swelling, pneumonia, even death. Lauren Pelly, CBC News, Toronto.
Well, let's bring in Dr. Isaac Bogosh, infectious disease specialist. And Dr. Bogosh, how concerned should we be in Canada about the possibility of a measles outbreak?
We have to remain vigilant, and it's really important that we maintain very high levels of vaccination. We're seeing a significant rise in global measles cases. We know there's lots of travel, international travel, and people landing in Canada. And of course, we have measles cases here in Canada, both brought in from abroad, but also locally acquired. So we have to really make sure our vaccine rates are well above 90% to prevent onward transmission and subsequent cases in Canada.
And speaking of travel, we're at that time of year where a lot of Canadians are thinking about going away for spring break. What advice do you have for them in terms of measles?
It's extremely important that people are up to date on their vaccines. Obviously, kids are getting 2 doses of a vaccine. Remember, in Canada, that second dose was added in 1996. So there's a lot of people that have 1 dose of a vaccine that could benefit from a second dose if they're traveling internationally, especially to an area of high measles transmission.
I've heard there should be at least a 4-week gap between the shot and immunity kicking in. What happens if somebody's leaving the country in 2 weeks from now?
2 weeks is just fine, and even if it's less than 2 weeks, it's certainly better to get the shot than to not.
All right, get the shot. Dr. Bogosh, thank you very much.
My pleasure.